be safe and effective in pregnancy, lactating women and children. Moving forward, what anemia is. Anemia is a condition in which oxygen carrying capacity of blood is reduced. Various types are characterized by decreased number of RBCs, hemoglobin in blood. According to WHO, hemoglobin less than 11 gram per deciliter in children and pregnant female, less than 12 gram per deciliter in non-pregnant female, and less than 13 gram in males should be considered as anemia. Prevalence and impact of anemia. In children of age group 6 to 59 months, 58%, adolescent girls 54%, and boys 29%. Women of reproductive age group 53%, pregnant and lactating women 63 and 58%. Globally, 50% of anemia attributed to iron deficiency, which accounts approximately 8.41 lakh deaths annually. Impact: poor concentration, palpitations, weakness, shortness of breath, increased risk of infections, etc. In Unani system of medicine, anemia is described as Sulkanya, Fakruttam, Pillatuttam, and Fasaduttam. Many single and compound drugs have been recommended for iron deficiency anemia. Few examples are Anar, Khurma, Chukandar, Mavis, Munakka, Kursi Kushta, Hadid, Khubsul Hadid, Sharbate Fawlad, tablet Damvi, etc. Several research papers have been published with proven efficacy of iron deficiency anemia. Examples are Sharbate Fawlad. They took 50 patients of age group 18 to 60 years, completed the study, who completed the study. Dose and duration was 12 milliliter twice daily for 90 days. The conclusion of the study was the drug possesses significant hematinic effect and didn't induce any toxic effect, particularly on liver and kidney. Next drug is tablet Damvi. 40 patients of 18 to 65 years completed this study. This was a randomized control trial. 20 patients in test group and 20 in control group. Dose and duration was test group 2 tablet Damvi twice daily for 90 days, and in control group 1 tablet Fasolate daily for 90 days. Conclusion of the study was test group patients had shown better response in most of the clinical and clinical sign and symptom than control group. The test drug is effective and safe in management of iron deficiency anemia. Next is Damvi. 102 patients of 18 to 65 years of age completed the study. Dose and duration was 2 tablet, 25 milligram each, twice daily for 56 days. The conclusion was the drug improves anemia and possesses significant hematinic effect, and also did not induce any toxic effect, particularly in kidney and liver. Next is Sharbate Mavis. 60 patients of age group 15 to 60 years completed the study. Dose and duration was 25 milliliter twice daily for 90 days. The conclusion was it provides iron supplement and manages most of the etiologies of iron deficiency anemia. And they found that it was not effective on chylomicria even after the study. It accelerates metabolic processes of liver, as it is mucovae, maida and jigar. Next is Safufi Khabsul Hadid. 60 patients were taken. The patients were pregnant women of second and third trimester who completed this control trial. 30 patients in test group and 30 patients in control group. Dose and duration was test group 3 capsule per day for 45 days. One capsule was of 1 gram. Control group were given Fefol per day orally for 45 days. Conclusion was test drug was as effective as the standard drug in improving iron deficiency anemia during pregnancy. No significant improvement seen in sign and symptoms in both the drugs, maybe because of short duration. Next is Majun Khabsul Hadid. 40 patients of 16 to 65 years completed the study. Dose and duration was 6 gram twice daily for 60 days. The conclusion of the study was that drug not only provides the iron supplement but also manages most of the etiologies of iron deficiency anemia. Improved symptoms, but there was no improvement in seen in कोइलोनाइकिया. पुरसे कुश्ता फौलाद and शरबत अनार शीरी. 60 patients, adults, completed the study. Dose and duration was one course with 25 ml Sharbati Anar twice daily for 90 days. Conclusion was that drug improved clinical symptoms and signs as well as mild to moderate complications of iron deficiency anemia. Also improved laboratory parameters and liver metabolism. Above said drugs are effective as well as increases the hemoglobin and RBCs. Some of them were very effective in improving sign and symptoms too. In patients having koilonicia, there was no improvement seen even after the study. The main concern of the is there are very few proven drugs which are safe in pregnancy and lactating mothers and children. So there is a need of more research for them, as it is a very common in the said group. The limitations of the above all researches are what I found. The maximum of the them excluded pregnant and lactating women. It was not good. Iron deficiency is the most common but hazardous ailment, which, if not treated on time, may have dangerous outcome. Hence, more research-validated drugs are needed so that the same can be suggested to the general public, especially for vulnerable groups like pregnant, lactating women, and children. Thank you.
Thank you, Dr. Kazmi. Thank you, Dr. Afeefa Kazmi. This was the last presentation of this session. Now I may request our chairpersons to conclude this session. Professor Abdul Latif and Professor Nasreen Jahan. The 7th conference